As we continue to learn more about this Ebola outbreak, it can be hard to know where to get the right information. Homa Bash joining us now with that side of the story. Homa.
Chris, whenever there's any kind of scare like there's a ton of information flying around. It can be hard for people to grasp what they need to know and what's important. That's why officials want people to reach out to services like the Cuyahoga County 211 Center or their own doctors before calling emergency services.
The same way with AIDS, they were paranoid. They would be paranoid with this situation until they get a better understanding.
As any disease outbreak spreads, so does misinformation.
Thanks for calling 211. This is Richard speaking. How may I help you today?
That's why 211, the free 24-hour service available for anyone to call, is trying to be proactive when it comes to Ebola.
Well, we've really been ramping up in terms of our information in our database to make sure that we have the information that public health and emergency management would like us to distribute.
During a 24-hour period on Thursday, 211 workers got 78 calls related to health issues. 13 of those were questions or concerns regarding Ebola.
Asking about general information. How is it contacted? Just the general FAQs regarding Ebola.
211 Director Diane Gatto says people are not calling in a panic, and they shouldn't be.
They just want to make sure that they understand what they're hearing on the news appropriately. They want to understand what they're reading.
The point of the call center in this case is to give people the facts.
So it's kind of like a triage setup.
However, if someone calls with a serious concern about exposure, they'll be directed over to their county health department, their doctor, or the CDC. But for most people, at this point, the first call shouldn't be to emergency services.
And you want to make sure that you reserve 911 and you reserve public health for emergencies.
Now, for comparison, the 211 Center in Cleveland has gotten about 8 calls relating to the flu in the last month and a half, compared to more than a dozen asking questions about Ebola just since yesterday. Back to you.